TAVI is short form for transcatheter aortic valve implantation. It is also called TAVR, transcatheter aortic valve replacement. Aortic valve is the valve between the aorta and the left ventricle. Aorta is the largest blood vessel taking oxygenated blood to the whole body. Left ventricle is the lower muscular chamber of the heart which pumps oxygenated blood to the whole body. When the aortic valve is severely damaged, earlier it used to be repaired or replaced surgically. Now we have the option of implanting a valve without surgery through tubes introduced through small holes in the blood vessels of the groin. When TAVI was initially introduced, it was done only for those at very high risk for surgery. But as the procedure was perfected and the features of the device improved with better technology, it is now being recommended for those with aortic valve disease and low risk for surgery as well. As of now, the valve used for TAVI is quite expensive, but the cost will gradually come down as the number of procedures being done worldwide increases. Please view the full version of this video at my Cardiology Talks channel and subscribe for updates. Useful for early career medicos and paramedics. Link given below this video.